I should have got my water. Dang it. Hey, boo, hey. Okay. What's today? Like June or something. What? Let's do this one. Let's do this one. Sure. Hey, boo, hey. All right, guys. It is. I was going to say, y'all know what today is. It's Thursday. Okay, it's not Thursday. It's Friday. So, if you are here, then you should probably be here because we rescheduled NCLEX Jeopardy from just for this week, from last night, which was Thursday night, to tonight, Friday night. It was just this week only. It's a scheduling thing. This isn't gonna be every week. But yes, it is NCLEX Jeopardy time, and it's time for our free NCLEX Jeopardy review. I am bringing up our game. All right, so if it's your first time here for NCLEX Jeopardy, please let me know. Comment in the comments right here that it's your first time. If it's not your first time, you're a repeat offender. Hello, welcome back. So, Nurse Sam here. Hello, hello. Making sure you guys get into nursing school, get through nursing school, getting out of nursing school, and passing our NCLEX. Y'all could be the amazing nurses I know y'all could be. So to help with that, I started doing NCLEX Jeopardy 2 years ago. Oh my God, 2 years ago this month. And we do that weekly. And it is our fun review session for our NCLEX, whether it's RN, NCLEX RN, or NCLEX PN. Our topics for today. So just like Jeopardy style, I don't know if you guys have played Jeopardy before. But just like Jeopardy, you have your blue screen, your categories. Our categories for tonight's NCLEX Jeopardy session is pharmacology, pharmacology, pediatrics, mental health, fundamentals, and adult health / med surg. We have 5 questions per category, ranging from 100 points to 500 points. And with that being said, of course, we're playing 4 points and for prizes, just to make it fun. You know, on the actual real NCLEX, y'all know that it's not in Jeopardy style, so you don't have to say what it is. But to, you know, stay in theme with the whole NCLEX, with the whole Jeopardy thing, in order for you to answer and qualify to get these points, you have to say what is before your points, well, before your answer. So if we have a question and the answer is like number 2, you have to say what is 2, well, option 2. What is 2? You have to say what is, okay? You have to be first on my screen to say it, just in case there's some connectivity issues. Maybe your session's running a little bit like lagging or whatever. Some people may have different answers on their screen. I can't see your screen. I can only see my screen. So I can only do it based on my screen. All right. So if Susie Q answers before you on my screen, but on your screen says they answered after you, don't shoot me. I can only go by my screen. Hey, boo. So hello, all my first timers, all my returners. What's up, what's up, what's up? Awesome. So if you have anybody else that's either studying for their NCLEX or about to start nursing school or currently in nursing school, this review will help. It's just, people will ask me, when's the best time, when's the earliest time I can start reviewing for my NCLEX? When you get that acceptance letter. Day 1, numero uno, okay? It's just going to help in the end. Okay, so that's why we started doing these NCLEX Jeopardy reviews. It's just to make it a little fun and motivating and not so overwhelming. Okay? Oh, thank you guys. Hey, Lauren. What's the NEV? What's the NEV? I'm not sure what that is. All right, so with that being said, quick little run through. I'm going to read the question. I'm going to read the answer choices, and you guys have to answer, like I said, Jeopardy style. You have to say what it is. All right, once again, the categories are pharmacology, pediatrics, mental health, fundamentals, and adult health. I'm usually here for the T's, but I'm here for the NCLEX too. Woohoo! Good. Honestly, you should be practicing both. Should be practicing both. If you are, well, if you're about to take your T's, then, you know, it wouldn't hurt to obviously do your T's Jeopardy and then come over for NCLEX Jeopardy so you know what you're getting into. All right, so let's go ahead and get started. I'm going to read the question and we'll read the answer choices, and you guys are going to answer. If y'all have any questions, just put them right here in the comments, and I will answer them, or another player that's played before will answer them. All right, so let's go ahead and get started with, let's start with farm. Let's start with farm. All right, let's start with farm for 200, okay? All right, so the first question reads, wait, where's my handy dandy notebook? 1 second. Okay, got it. So I can keep score. All right. Farm for 200. The question reads, a hypertensive client has been prescribed clonidine hydrochloride, a transdermal patch. The nurse provides written instructions to the client on the use of the patch. Which statement by the client indicates the need for further instruction? We've gone over this. We've talked about this. These wordings. Specifically this one, the need for further instruction. We've talked about this multiple times. All right, so once again, which statement by the client indicates the need for further instruction regarding the use of this transdermal patch that's clonidine hydrochloride? Is it 1, I need to change the patch every 24 hours? Is it 2, I need to apply the patch to a hairless body site? Is it 3, I need to apply the patch to skin areas that are not broken? Or is it 4, I need to apply the patch to the skin on the upper arm or body? Which statement by the client indicates a need for further instruction regarding the use of a transdermal patch? All right, I'm going to read it one more time. A hypertensive client has been prescribed clonidine hydrochloride, a transdermal patch. The nurse provides written instructions to the client on the use of the patch. Which statement by the client indicates the need for further instruction? 1, I need to change the patch every 24 hours. 2, I need to apply the patch to a hairless body site. 3, I need to apply the patch to skin areas that are not broken. And 4, I need to apply the patch to the skin on the upper arm or body. Which one is our answer? Let's look and see. The answer is, what is, that's my drum roll. What is 1? The answer is, what is 1? I need to change the patch every 24 hours. Every 24 hours. Let me see who answered first on my screen. All those that are just answering run. Don't forget, this is NCLEX Jeopardy. You have to say what is and then your answer. All right, otherwise it won't count for NCLEX Jeopardy. On the NCLEX, do what you please. But this is just for our incentive and for fun. But you have to say what is to qualify. All right, so the first person to say what is on my screen is Binta Kib. Let me make sure. Yep, Binta Kib. Hello, hello. Awesome job. All right, so Binta Kib, you are on the scoreboard with 200 points. Awesome job. Great job. Marnette Stalling, you also got it, but you didn't say what is. But as long as you got the answer, then I'm still going to call you out because obviously on the NCLEX, you would have gotten it correct. So you comprehend the information. Marnette Stalling got it. Tiara 88, Armani Mommy, Natural by Nature Billionaire, Lauren, Jew, Brianna, Anointed Hands, Future Nurse April, Key Keynes, Chiquita, Wenda, Marta. Awesome job. Great. So, rationale-wise, it says clonidine is an anti-hypertensive medication that is applied every 7 days to a hairless, intact skin area of the upper arm or torso. All right, the remaining options are correct statements. It looks like everyone got that answer, so yay, round of applause. Just in case you don't know, or just in case you didn't answer, remember whenever you have a question that says which statement indicates a need for further teaching, you're looking for the statement that is wrong. Okay, you're looking for the statement containing incorrect information, hence the client needs further instruction because they don't understand what you're saying just yet, because they gave you false information. All right, so a little tip, whenever you have those questions, read each question and run through like a true or false, like say true or false, is this true or false for each question or each answer choice as you go through each one so you don't get confused. Okay, but yes, the answer is 1. It's not, you don't change the patch every 24 hours. For this, for clonidine, you change the patch every 7 days. Okay, everything else is true regarding use of a transdermal patch. So great job to everyone on that one. Let's go ahead and move on to mental health. All right, this one's mental health for let's do mental health for 400. Mental health for 400 points. I'm going to read. You guys are going to answer. The nurse should include which information in the medication teaching plan for a client diagnosed with schizophrenia? The nurse should include which information in the medication teaching plan for a client diagnosed with schizophrenia? Is it 1, coffee, tea, and soda consumption should be limited? 2, if the client is compliant, the relapse of symptoms will never occur. 3, psychotropic medications may cause mild cardiovascular symptoms. Or 4, most schizophrenic clients are able to taper off their medications eventually. The nurse should include which information? The nurse should include which information in the medication teaching for a client diagnosed with schizophrenia? What is our answer? It's okay, you take your NCLEX tomorrow. Girl, you should be watching a movie, get a massage or something. Remember, the night before NCLEX, you really shouldn't be studying. You really should not be studying the night before an NCLEX. You should just kind of be chilling out. All right, I'm going to say the answer choices one more time. 1, coffee, tea, and soda consumption should be limited. 2, if the client is compliant, the relapse of symptoms will never occur. 3, psychotropic medications may cause mild cardiovascular symptoms. Or 4, most schizophrenic clients are able to taper off their medications eventually. Let's see what our answer is. Okay, good. I'm good. It's K. Well, good luck to you, love. I can't wait to get a message from you sometime next week saying, "Oh my God, Sam, I passed my NCLEX. Oh my God," because it's coming. Good luck, boo. All right, so our answer to this question is what is 1? I'm just kidding. What is 1? All right. Coffee, tea, and soda consumption should be limited. All right. Really quick, why are we limiting coffee, tea, and soda? What is it about coffee, tea, and soda that makes us want to limit it in a client diagnosed with schizophrenia who's about to start their medication? What is it in common with coffee, tea, and soda? Absolutely, it's the caffeine. All right. Caffeine can inhibit the action of a psychotropic medication. Commonly prescribed, the ones that are commonly prescribed for schizophrenia. Most clients will require continuous medication therapy to manage their symptoms. Although medication compliance is a strong factor in minimizing the reoccurrence of relapses, what is wrong with me? Relapse could occur. All right. So number 2, it says if the client is compliant, the relapse of symptoms will never occur. First of all, anything absolute NCLEX does not like. So, like, never is such an absolute word. Like, never, jeez. That's just very absolute, and NCLEX is not. No. If there's an answer with an absolute answer in it, most likely it's not the choice. Okay? With this one saying that a relapse of symptoms will never occur, that's a strong statement. That's not even true. They might occur. They minimize the chance of reoccurrence, but it doesn't completely eliminate symptoms. And then it says cardiovascular symptoms are not typical side effects of psychotropic medications. So number 4 is just wrong. So the answer is, what is 1? Let's see who got it. Let's see who got it. Key-K-ness. Key-K-ness. Congratulations, you're on the scoreboard with 400 points. And now first place. So awesome job, Kika? I'm not sure. Who else got it correct? Ju, Lauren, Anastasia, Saren, a noted hand, Tiara, Marta, Chiquita, Wingy, I am Addie. Right, and then you guys will tell me, yes, it's definitely the caffeine. It is the caffeine. Awesome job to everyone that got that correct. All right, let's go on to our next category. And let's do fundamentals for 300. Let's do fundamentals for 300. Fundamentals for 300. All right. If you are just coming in, welcome, welcome. This is our NCLEX Jeopardy, usually done on Thursdays, but we have a scheduling issue. So I had to reschedule it for Friday, which is today. All right. So I'm reading the question and the answer choices, and you guys are answering. You have to say what is, because it is Jeopardy style. So just copy and paste like what is before every answer. It'll save you a couple seconds. Pro tip. All right. So fundamentals for 300. A client with tuberculosis whose status is being monitored in an ambulatory care clinic asks the nurse when it is permissible to return to work. The nurse replies that the client may resume employment when which occurs. 1. 5 sputum cultures are negative. Number 2. 3 sputum cultures are negative. 3. A sputum culture and a chest x-ray are negative. Or 4, a sputum culture and a tuberculin skin test are negative. What is our answer? A client with TB or tuberculosis asks the nurse when is it permissible to return to work. The nurse replies that the client may resume employment when which of the following occurs. Is it 1, 5 sputum cultures are negative? 2, 3 sputum cultures are negative? 3, a sputum culture and a chest x-ray are negative? Or 4, a sputum culture and a tuberculin skin test are negative? What is our answer? What is our answer? Ooh. Ooh, this one got a lot of y'all. So the answer is, what is 2? 3 sputum cultures are negative. 3 sputum cultures are negative. That's when it is permissible for someone that's already been diagnosed with TB to return back to work. When 3 sputum cultures are negative. Who got that first? Anastasia Antonio. Great job and great catch, Anastasia. We're going to go over the rationale in just a second. Antonio. All right, love, you are on the scoreboard with 300 points. Awesome job. Who else got what is 2? Oh, Bentica, you changed your answer to what is 2 right after she put it back. So I'm glad you caught that. Keandra, you also got it. And I think that was, wait, no. Ju is Everyone's like, how? We're going to go over it. All right, so it says the client must have sputum cultures performed every 2 to 4 weeks after initiation of an anti-tuberculosis medication therapy. The client may return to work when the results of 3 sputum cultures are negative because the client is considered non-infectious at that point. Therefore, the remaining options are incorrect. So a negative chest x-ray does not mean the client is non-infectious. A positive tuberculin test never reverts to negative. So if they've already been diagnosed with tuberculosis, getting a tuberculin test, it's going to show up positive because they've had TB. Does that make sense? All right, so once again, that big takeaway there, because a lot of you guys chose number 3, is that a negative chest x-ray does not mean that the client is non-infectious. Okay? If they're returning back to work, they have to be non-infectious. All right? Great job. Great job. Let's go ahead and do... Okay, sure. This is pediatrics for 500. Let's do this one. Peds for 500. Let's do it. A mother arrives at the clinic with her 3-year-old. You're joking. Can y'all hear me? Give me a thumbs up if y'all can still hear me. Every time. I think I was charging my, not my laptop, my mouse. Can y'all still hear me? Okay, perfect. All right, so pediatrics for 500. A mother arrives at the clinic with her 3-year-old child. The mother tells the nurse that the child has had a fever and a cough for the past 2 days, and that this morning the child began to wheeze. Viral pneumonia is diagnosed. Based on the diagnosis, the nurse anticipates that which will be a component of the treatment plan. So 1, oral antibiotics. 2, supportive treatment. 3, hospitalization and IV antibiotics. Or 4, IV fluid administration. Which will be a component of the treatment plan for this 3-year-old child that has been diagnosed with viral pneumonia? What is our answer? Is it 1, oral antibiotics? 2, supportive treatment? 3, hospitalization and IV antibiotics? Or 4, IV fluid administration? What is our answer? What is our answer? I would have got that wrong. I would have got that wrong. That makes me mad a little bit. This one is a little tricky. This one is a little tricky. Now, don't forget to say what is. All right. All right. So the answer to this one is what is 2, supportive treatment. What is 2, supportive treatment? Bentakib got that one first. All right, Bentakib, you're already on the scoreboard with 200 points. You just got this one correct for 500, so you are now at 700. Love. Who else got it correct? Lauren got it. Naturally by Nature Billionaire got it. Marta got it, but she didn't say what it is, but it's okay. Who else? Absolutely, it is viral. Yay, Vasilla. Woohoo! I had to go and take a picture. Let me see. But yes, it is viral pneumonia. Remember, no antibiotics are needed for viruses. Okay? It says with viral pneumonia, treatment is supportive. More severely ill children may be hospitalized and given oxygen, chest physiotherapy, and IV fluids. However, antibiotics are not given. If it was bacterial pneumonia, okay, it'll be treated with antibiotic therapy. Remember, antibiotics are the same thing as antibacterials. Antibacterials won't do nothing. It's like taking Skittles with a virus, with a viral infection. Like, what are you doing? What are you doing? It's like those people that call and be like, hey, I have the flu. Can I have some antibiotics? No, ma'am. No, ma'am. So, yes, viral was the key component there. No antibiotics are given. So, great catch. Great job. Don't look at anything else like that. Why are you shitting on Sprint like that? Lauren, don't make me laugh. All right, great job. That was a good one. That was a good one. All right, let's go into, we did fine, peds, mental health. Okay, let's go into adult health. All right, let's do adult health for, actually, let me see which one I want to do. The next one is adult health, guys. Sure, let's do adult health for 200. Which is med-surg, basically. The nurse is assessing a client's legs for the presence of edema. The nurse notes that the client has mild pitting with slight indentation and no perceptible swelling of the leg. You got that? I'm going to read that one more time. All right. We're assessing a client's legs for edema. This is what the nurse notes. The client has mild pitting with slight indentation and no perceptible swelling of the leg. How should the nurse define and document this finding? Is it 1 plus edema? 2 plus edema? 3 plus edema? Or 4 plus edema? All right. Mild pitting with slight indentation and no perceptible swelling of the legs. What kind of, well, how should the nurse define and document this finding? Wait, I get. Woo. All right, so the answer is, what is 1? What is 1? 1 plus edema. 1 plus edema. I think Bentakib got that one first. Bentakib is on her toes. Okay, great job, Bentakib. You already had 700, so you just got another 200. Bring your score to 900. Who else got what is 1? Joyce, Nessa, Marta, Lauren, Ju, Saren, Armani, Mrs. LeKay, Make Damon, Uptown Shiz. Awesome job. What service you got? Apparently not Sprint, because you just shitting on Bolo Sprint. All right, so great job, everyone that got 1 plus edema, or what is 1. Awesome job. So rationale here, it says edema is the accumulation of fluid in the intercellular spaces and is not normally present. All right. To check for edema, the nurse would imprint his or her thumbs firmly against the ankle malleolus, the ankle, or the tibia. Normally, the skin surface stays smooth. If the pressure leaves a dent in the skin, so if you're going like, pretend it's the ankle right here. It's bony just like the ankle. Pretend it's the ankle right here. All right, you got to press both thumbs, all right, firmly against that malleolus. Like I said, we're pretending. Okay, so when you're pressing, it's supposed to normally stay smooth. Okay, now if this pressure leaves a dent in the skin, pitting edema is present. All right, so think of like literally pitting edema. I wish I had something that could be. Dang, I wish I had a better example. All right, so when you think of pitting edema, think of a pit. Okay. Its presence is graded on the following 4-point scale. All right. 1+ is mild pitting with slight indentation and no perceptible swelling of the leg. It's just really, it's there, but it's not super severe. It's mild. 2+ edema is moderate. All right. Indentation subsides rapidly. And then 3+, that's a deep pitting. All right. Indentation remains for a short time. And the leg looks swollen. And then 4+ is very deep pitting edema. Indentation lasts a long time and the leg is very swollen. All right. Make sure you know your edema scales. And from the looks of it, most, if not all of you guys already do. So great job. All right, so now let's go ahead and reset. Let's go back to farm. Cool. Let's do farm. Lauren's funny. All right. Okay, sure. Let's do this one. This one is pharmacology for 400. Pharmacology for 400. All right. Mafenide acetate. Mafenide acetate. That is prescribed for a client with a burn injury to the hand. Which should the nurse include in the instructions to the client regarding the use of this medication? Yay, I'm glad. Armani said, this is so nice of you. I'll be back every week. Awesome, because it's free review. It's so fun. It's our time to just get together and gossip. I'm just kidding. We're doing reviews. But yes, mafenide acetates, all right, that's prescribed to a client with a burn injury to the hand. Which should the nurse include in the instructions to the client regarding the use of this medication? 1, if stinging occurs, discontinue the medication. 2, apply a thinner film than prescribed to the burn site if the medication stings. 3, if local stinging and burning occur after the medication is applied, notify the healthcare provider. Or 4, it is normal to experience local discomfort and stinging and burning after the medication is applied. I know which one I would pick. All right, the medication is the mafenide acetate, and that is prescribed to a client for a burn injury to the hand. Yep, I would say what it's for too. I would definitely say what it's for too. That's what I would say. Ooh, wouldn't y'all be mad if we're all wrong? NCLEX can be petty like that. Watch some word that we didn't see. I'm just kidding. Let's be confident in our answer. It's what it's for, period. I just want to check. All right, cool. So the answer is what it's for. We got it right, y'all. We got it right. All right, so I don't know about you guys, but no, I do know about you guys. There's not one single one of you that can or will remember every single medication ever. It's impossible. It's literally impossible. So for me, I don't know what the hell mafenide acetate is. I don't remember that, period. You can if you don't know the medication, kind of use test taking strategies to make sure you have whatever answer that you're comfortable with. Okay. The answer, once again, is what it's for. It is normal to experience local discomfort and stinging and burning after the medication is applied. Rationale says mafenide acetate is a bacteriostatic for both gram-negative and gram-positive organisms, and is used to treat second and third degree burns to reduce the number of bacteria present in avascular tissue. I learned something today. I didn't know what methionine acetate is. Didn't know what it is. I don't know if it's going to commit to this memory of mine, but we'll try. All right, it says the client should be informed that the medication will cause local discomfort, stinging, and burning, and that is normal. All right, so therefore options 1, 2, and 3 are incorrect. What I did personally, I'm not saying be like me, but me personally, my test taking strategy skills, 1, 2, and 3 all sounded very, very similar, and number 4 was the only thing that said that the discomfort and stinging was normal. Everything else was like, look, if stinging occurs, discontinue, tell your mama, go cry, go tweet about it. There's a bunch for 1, 2, and 3. So just process of elimination, I was like, let me go with 4, okay? Fortunately, that was the correct answer. Now we know what methionine acetate is, and that just, stinging and burning is normal. Plus, if I have a burn injury to my hand and it's not like a super deep burn where all my nerves are like gone, I'm gonna expect some stinging. I'm gonna expect some stinging and burning on a burn injury, period, okay? Oh, I missed you guys too. Thank you, Vincent Kib. I missed y'all too. All right, so pharmacology. Did I say who won? No, I didn't. Hold on. Let me look and see who got what is for first. Wait for it. Wait for it. I'm gonna just scroll. Naturally by Nature Billionaire. Awesome job. Natural by Nature Billionaire. Congrats to you, love. You got 400 points. Who else got it? Benta Kib got it. Anastasia, Saren, Tiara. Natural, you gave that face, but you got it correct, and you got it first. Mrs. Lakia, Kike. Awesome job. All right, let's go ahead and move on. That was farm. Let's do let's do mental health for 200. Mental health for 200. A client comes to the emergency department after an assault and is extremely agitated, trembling, and hyperventilating. What is the priority nursing action for this client? 1. Begin to teach relaxation techniques. 2. Encourage the client to discuss the assault. 3. Remain with the client until the anxiety decreases. Or 4. Place the client in a quiet room alone to decrease stimulation. Reading that one more time. A client comes to the emergency department after an assault and is extremely agitated, trembling, and hyperventilating. What is the priority nursing action for this client? 1. Begin to teach relaxation techniques. 2. Encourage the client to discuss the assault. 3. Remain with the client until the anxiety decreases. Or 4. Place the client in a quiet room alone to decrease stimulation. What is our answer? The answer is what is 3? Remain with the client until the anxiety decreases. Natural by Nature, you got that one again. You had 400 points, so you just got 200 points added to your score. So now you have 600 points. Awesome job. Who else got what is 3? Anastasia, Tiara, Kike, Bentakib, Kayla, Make Damon, I'm not sure. Olga, I am the ambitious. Please go away. Yes. All right. So 3. Y'all can still hear me, right? Can y'all go away? Why is that? Okay, cool. So rationale says this client is in a severe state of anxiety. All right, when a client is in a severe or panic state of anxiety, it is crucial for the nurse to remain with the client. The client in a severe state of anxiety would be unable to learn relaxation techniques. Yes, if someone's in the literally mid-panic attack, don't be like, breathe in and out. Let me just teach you some guided imagery. You most likely will get cussed out. NCLEX won't tell you that, but in real life, do not do that. Don't do that. It says discussing the assault at this point would increase the client's level of anxiety further. Placing the client in a quiet room alone may also increase the anxiety level. All right. So yes, the best thing to do is remain with the client until the anxiety decreases. Okay. Awesome job, everybody. Yeah, okay, so I gave that. All right, now let's do another one. Ooh, this is good, but this one's pretty common as far as assessment wise, so I just want to make sure you guys know this. Okay. All right. This is pediatrics for 300. Maybe easy to some. Some people may not know at all. I don't know. All right. So pediatrics for 300. A nurse is caring for an infant with a respiratory infection and is monitoring the infant for signs of dehydration. What is the nurse's best action to determine fluid loss in the infant? One more time. What is the nurse's best action to determine fluid loss in the infant? 1, monitor body weight. 2, obtain a temperature. 3, monitor intake and output. Or 4, assess the mucous membranes. All right, we're monitoring an infant for signs of dehydration. So what is the nurse's best action to determine fluid loss in the infant? Is it 1, monitor body weight, 2, obtain a temperature, 3, monitor intake and output, or 4, assess the mucous membranes? Ooh, I'm saying we're going back between 1 and 3. Which one is it? Which one is it? Remember, this is pediatrics. Pediatrics. What is our answer? What is our answer? What is our answer? All right, the answer is what is 1, monitor body weight. Monitor body weight, absolutely. It says body weight is the most reliable method of measuring body fluid loss or gain. 1 kilogram of weight change represents 1 liter of fluid loss or gain. The remaining options, those are appropriate measures to assess for dehydration, but the most reliable method is to monitor body weight. That's the most reliable, best was the word in here. Best, the best action. All right, so you're looking for the most accurate and most reliable, and body weight and monitoring body weight is the most accurate, and that's really for peds or adulthood, right? Oh, I was like, obtain a temperature. Oh, obviously, because when you're dehydrated, you get a fever. All right, who said what is one first? Angel Rose, you said wait, but you didn't say what is. You didn't say what is. Tiara 88 got it first. Said what is one? So Tiara, congratulations, you were on the scoreboard. Spell Tiara. Tiara 88 underscore Z. What is one? You got 300 points for answering this one correct. Who also got what is one? Or wait. Momo, Solio, Kikanis, Lauren, Olga. Lauren said I thought she was going to say Pampers. Ruby Red. I am the ambitious one. Nisha X. B Monroe. Awesome job. Question. No, never mind. Never mind. Never mind. All right. Let's do, what was that, peds? We did that. Let's do this. Fundamentals for 500. Yes, you have to say what is first. All right. For anyone that's just joining, this is NCLEX Jeopardy, and in true Jeopardy style, you have to say what is before your answer. So it'll be what is and 1, 2, 3, or 4. All right. So this is fundamentals for 500. The nurse is inserting an indwelling urinary catheter into the urethra of a male client. As the nurse inflates the balloon, the client complains of discomfort. The nurse should take which appropriate action? 1. Aspirate the fluid, remove the catheter, and insert a new catheter. 2. Aspirate the fluid, advance the catheter farther, and reinflate the balloon. 3. Remove the syringe from the balloon. Discomfort is normal and temporary. 4, aspirate the fluid, withdraw the catheter slightly, and then reinflate the balloon. All right, we are inserting an indwelling urinary catheter into the urethra of a male client. Have y'all ever done that before? It'd be like this. That thing just shrivel up like a turtle. Sorry. It just go back like this. Let me stop. Okay, so as you are inserting that indwelling catheter into this male's urethra, and you inflate the balloon, the client complains of discomfort. The nurse should take which appropriate action? 1. Aspirate the fluid, remove the catheter, and then a whole new one, insert a whole new catheter. 2. Aspirate the fluid, advance the catheter farther, and then reinflate the balloon. 3 is remove the syringe from the balloon. Discomfort is normal and temporary. And then 4 is aspirate the fluid, withdraw the catheter slightly, and then reinflate the balloon. What is our answer? Do not laugh at me. Woo-wee. At least with the male, there's no like other hole. I will say that. It's just one opening. All right. The answer to this question is what is 2. Aspirate the fluid, advance the catheter farther, and then reinflate the balloon. That is the correct answer. Who said what is 2? Did anyone say what is 2? Yep. Benta Kib got that one. All right, great job, Binta Kib. You got 500 points added. So now you have a score of 1,400. You crossed over into the 1,000 club. Awesome job. All right, so this is our, wait, who else got with us too? Ruby Red, Marta. Awesome job. All right, so rationale says, Rationale says, if the balloon is positioned in the urethra, inflating the balloon could produce trauma and pain will occur. If pain occurs, the fluid should be aspirated and the catheter inserted a little farther into the bladder to provide sufficient space to inflate the balloon. All right, the balloon of the catheter is behind the opening at the insertion tip. All right, so let's say that sure. Let's say this is our catheter. Okay, just pretend this is a pointy tip. Let's say this is a pointy and a smaller tip. All right, the balloon would be like right here. The balloon would be like right there. And that's basically, it's like a stopper, basically. It stops it from coming out. So when you inflate that balloon, it secures and it anchors that indwelling catheter in the urethra. But once again, if you have something in your urethra and then all of a sudden something inflates and puts pressure on the surrounding area, it could be painful. So when that happens, just take out some of that, when they say aspirate, take out some of that fluid from that balloon. So you're deflating that balloon and then advance it just a little bit more so that the balloon, when you reinflate the balloon, it's not in that same area. Go further into the bladder so you can have more space for that balloon to be inflated to cause less pain. Okay. Yes, all right. Inserting the catheter, the extra distance will ensure that the balloon is inflated inside the bladder and not in the urethra, which is what I just said. There is no need to remove the catheter and insert a new one. Especially not with the male. You know, when you would insert a new one, when it's like not sterile, especially in females, when you're supposed to just withdraw and use a different one if you're going for the urethra and you go into the vagina instead or something like that. That sucks. I hate that for you, queen. Yes, you would have to insert a new catheter. And then pain when the balloon is inflated is not normal. Just like pain when you're on your period is not normal, despite what people say. Nothing to do with the question. All right, great job to everyone that got with us too. So I thought that's 4 said. 4 said, aspirate the fluid, withdraw the catheter slightly, and then reinflate the balloon. That was 4. You're not withdrawing the catheter slightly. You're advancing it farther. So 2 and 4 were the opposite answers. Once again, test taking strategy. If you see an answer choice that is the opposite of the other one, more than likely one of them is going to be the right answer. All right, so thanks for bringing that up. 2 says aspirate the fluid, advance the catheter farther, and then reinflate. And then 3 says aspirate the fluid, withdraw the catheter slightly, and reinflate the balloon. Those are opposites. Are we pulling back or pulling forward? Which one are we doing? Back and forth. You're going to advance it farther, not withdraw it. Okay, so that's why number 4 was not the correct answer, and number 2 was. I've only done women, so that's where my brain went. Oh, no, I feel you. If you haven't inserted a catheter into a male, you'll be in for a treat. You'll be in for a treat. It's easier to actually do, but men are cry babies when it comes to that catheter, child. They don't want nothing in their little pee-pee. All right, let's go to, what was that? Fundamentals. Ooh, wee! Adult health for 400. Adult health for 400. All right. Cardiac monitoring leads are placed on a client who is at risk for premature ventricular contractions, or PVCs. Which heart rhythm will the nurse anticipate in this client if PVCs are occurring? 1. A P wave preceding every QRS complex. 2. QRS complexes that are short and narrow. 3. Inverted P waves before the QRS complexes. Or 4. Premature beats followed by a compensatory pause. All right. We have a client at risk for premature ventricular contractions, or PVCs. Which heart rhythm will the nurse anticipate in this client if PVCs are occurring? 1. A P wave preceding every QRS complex. 2. QRS complexes that are short and narrow. 3. Inverted P waves before the QRS complexes. Or 4, or 4, premature beats followed by a compensatory pause. This was a good one. This was a good one. What is our answer, guys? What is our answer? Oh no. Don't make me laugh. What is our answer? PVCs, premature ventricular contractions. Let the name help you, honestly. Let the name help you. So the answer to this one was what? I'm gonna sit this one out. Y'all got it. Just let me know what the answer is. The answer is what is 4. Premature beats followed by a compensatory pause. All right. Number 4. I think only one person got that one. It was Saren. Saren Colley. Awesome job, Saren Colley. I see you. I see you, future cardiac. Saren. Wait, I lost your name. Colley. All right, so Saren Colley, you are now on the scoreboard with 400 points. Awesome job. Hey, boo, hey. Awesome. Great job. So it says PVCs are abnormal ectopic beats originating in the ventricles. All right. Remember, PVCs are premature ventricular contractions. Let that name help you. Contractions in the ventricle, that's premature. Okay. And that's exactly what that is. Abnormal ectopic beats originating in the ventricles. They are characterized by an absence of P waves, so there's no P waves in PVCs, the presence of wide and bizarre QRS complexes, and a compensatory pause that follows the ectopy, or the premature beat. Okay, so it's a premature beat, and then there's a compensatory pause. All right, so when I think about PVCs or premature ventricular contractions, all right, these contractions are happening, once again, prematurely, before it's time. Okay, so when I think of PVCs, I think of like, when you have like two people that are like walking, let's say that we're walking a distance or whatever, and you're supposed to walk at the same time. And then you have that one person that's like walking either too fast or too slow. That's what I'm thinking about. So the person that's walking too fast, are obviously they're going to get to that spot before they should. All right. And then what they're going to do is pause and wait for everybody else, wait for the other person to catch up. All right, so they're going to get there. It's going to be that premature beat. They're going to prematurely get to that location, and then they're going to stop and wait. Coming. It's a compensatory pause, all right? They're going to wait for everything else to catch up. All right, so PVCs, they play a game of like catch up. You're behind. It's not really they're behind. You're just too early, sis. So that's how I think of PVC. It's just kind of let the name help you. All right, premature ventricular contractions. All right. Let me look at what y'all saying. Nothing. Awesome job. Great. Let's do one more. We've done 2, 4, 6, 8, 10. We've done a lot. Go us. We've done a lot. Let's do one more, and it'll be for 500. I want that one. That one's so easy, I can't even take it. All right, let's do this one. This one is adult health again, but this one's for 500. Okay. All right. It says, yay, thank you. I'm glad y'all get it. The nurse is performing an admission assessment on a client with a diagnosis of detached retina. Which sign or symptom is associated with this eye disorder? 1, total loss of vision. 2, pain in the affected eye. 3, a yellow discoloration of the sclera. Or 4, a sense of a curtain falling across the field of vision. All right, we're looking for the sign or symptom that's associated with detached retina. Is it 1, total loss of vision? 2, pain in the eye. 3, a yellow discoloration of the sclera. Or 4, a sense of a curtain falling across the field of vision. There's like certain eye disorders that were drilled into my brain back in nursing school, and it was like detached retina, and there was something else. Ooh, I cannot remember what it was. It's gonna really bother me. All right, so let me see what y'all answering and what y'all saying. All right. The answer to this one, detached retina. All right, I think it's 4, me personally. But the answer to this, let's go ahead and see. Drum roll, please. It's not a drum roll, it's a knock. All right, the answer is what is 4? I'm biased because what is that? Keratoconus. Keratins and cones? I'm not sure what that one is. Lauren. But the answer is what is 4? A sense of a curtain falling across the field of vision. All right, so this one is 4. All right, so it says a characteristic manifestation of retinal detachment described by the client is the feeling that a shadow or curtain is falling across the field of vision. All right. No pain is associated with detachment of the retina. That's the interesting part of detached retinas, because it sounds so like your retina is detached, girl. It sounds painful, but there's actually no reported pain associated with it. And then total loss of vision and a yellow discoloration of the sclera. Those are not characteristics of this disorder. Quick question. A yellow discoloration of the sclera, what is that called? I know you know. Just tell me, what is it called? Cataracts. No, it's not called cataracts, but I'm looking at Anastasia. Her saying cataracts. I think that was one of the other eye disorders that was burned into our brain. But yes, a retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Really? So if you have a detached retina and your visual acuity is still normal, it's even worse. That sucks. All right, so absolutely, it's jaundice. A yellow discoloration of the sclera is jaundice. If you have a yellow discoloration of your sclera, you need to check them. I said it. Maybe y'all didn't hear me. What enzymes do you need to check if you notice jaundice in your patient? I think I said it, but just in case y'all didn't catch it, what enzymes do you need to check if you notice a patient with jaundice or yellow discoloration of the sclera? Liver, absolutely. Too much sauce. Lay it off. Lay it off, girl. Your eyes, it's giving me, your sclera is giving me Big Bird. It's giving me, no. Lay it off, okay? Yes, you need to check those liver enzymes. But yes, detached retina. Let me tell y'all what I think of. So first of all, y'all know I'm a theater kid, okay? Period. So with detached retina, it says it's a shadow or curtain falling across the field of vision. When I think of detached retina, in this specific manifestation, I think about the curtain call. Okay, you know, the part at the end of whatever play or musical that you went to go see. And literally the curtains come down. The curtains come down. And that's just what I think of when I think about detached retina. Curtain call. Detached retina, curtain call. All right. Let's see what I was saying. Or sickle cell. But usually sickle cell, that jaundice isn't because of the sickle cell. That jaundice is because of some kind of liver impairment from that sickle cell. Does that make sense? Like maybe there's a sickled cell that's impairing the liver, if that makes sense. All right. Great job. All right. Awesome. Hold on one second. I just want to... Okay, cool. Okay, so remember I said there was like certain eye disorders that were like drilled into my brain? Retinal detachment was one of them, and the other one was macular degeneration. Okay, so these types of questions, let me go back to it. So we know that number 3 was jaundice, and that's liver. Pain in the infected eye, that could be anything. Okay, they're looking for like the hallmark sign or symptoms that when people says, hey, I have this, the nurse is going to automatically think this. So if someone comes to you as a nurse and says, hey, I have pain in my eye, I'm not going to automatically be like, oh, it's macular degeneration. I'm not going to think that. I'm just be like, girl, what you got in your eye? Were you at the beach? Do you have sand in it? Did you poke yourself? What happened? So pain in the infected eye is just, it's not giving me enough. But macular degeneration, that is, I think that's slow but steady vision loss. It's an eye disease that causes vision loss. Blurred or reduced central vision. All right. So that's what I think about. But retinal detachment, curtain call. All right. Curtain coming over your field of vision. All right. Let me look and see. Aw, Lauren. Oh, I'm going to look up keratoconus now. All right, guys, that concludes our fun in this week's NCLEX Jeopardy. The winner of this week's Jeopardy is Binta Kib with 1,400 points. Binta Kib, do you have you won NCLEX Jeopardy before? I feel like you have, but do you have the Ultimate Nursing School bundle already, Binta Kib? I know you've, I believe you've won before, but if you have the Ultimate Nursing School bundle, let me know, and then we're gonna give it, and we can give it to the runner-up, Binta Kib. All right. Who would be our runner-up? Let me see. Is Binta Kib still here? Do you have the Ultimate Nursing School bundle? If you don't have it, or if you do already have it, if you've already won it, let me know and I will give it to the next person. Not playing for private, have everything, girl. Awesome. Aw, awesome. I'm passing someone's studying nursing school. Awesome. Thank you so much. All right, so then it passes from Bintikib to our runner-up, who is Natural by Nature Billionaire with 600 points. That's my clap. Great job. Awesome. So Natural by Nature Billionaire, you are the runner-up. For everyone saying, hold on. Wait for it. All right, everyone that's here, do not leave. Everyone that's here that has not purchased any digital study kit, don't leave. 1 second. 1 second. I have something for y'all. Do not leave. I'm gonna post it soon. I'm gonna post it as well, but y'all can be the first persons to get it. Okay, so first of all, Natural by Nature Billionaire, because you are the runner-up, you won a free Ultimate Nursing School bundle. Yee! So DM me your full name and your email address so I can get that right out to you. Everyone else, if this is your first time, if you have not gotten any of the tools, stay right here. Do not leave. Really quick. Hold on 1 second. Give me 30 seconds. Do not leave. Okay, here we go. Do not leave. Do not leave. And then we're gonna pump bounce. Do not leave. Perfect. All right. And I don't want you to leave because I have an awesome flash sale for you guys. All right. Yay, I'm so glad this is going to help a lot. Okay, so let me put it here. All right. We are doing a flash sale for you guys because I love you so much, and I know it's about to be like summer, so a lot of people are taking their NCLEX, a lot of people are taking their T's, whatever it is. So I want to make sure you are getting whatever you need at a very, very affordable price. So because you guys have came to my my rescheduled NCLEX Jeopardy, all right, and if you have not purchased anything, you guys get to enjoy 70% off any digital study kit or bundle. 70% off. All right, so use code LUCKY70. So this is to celebrate 70,000 followers. Thank y'all so much for bringing me to 70K on Instagram. Now I'm at like 71. Y'all are amazing. Y'all are awesome. So I want to give you guys a flash sale, 70% off any digital study kit or bundle. If you want the Ultimate Nursing School bundle, instead of $97 for the Ultimate Nursing School bundle, it'll be $29. Woohoo! So use code LUCKY70 at checkout. Hold on, I'm typing it right here. Checkout for 17% off all digital study kits. Wait, study kits and bundles. Woohoo! At thenursesam.com. Go to the link in my bio. Woohoo! All right, so I just posted it. Pinned comment. All right, and I posted it and I pinned it. All right, so use code LUCKY70 for 70% off any and all digital study kits. Y'all know even though you're studying for the NCLEX, just in case you're about to take the NCLEX and then maybe do a bridge program, so you need to take your T's or something, we just uploaded updated the T's bundle and added chemistry and biology study kits to that. Or if you just want the NCLEX bundle as well as the cardiac study kit, because remember, the cardiac study kit is not in the bundle. The Ultimate Nursing School bundle is full at 400 pages. So we're starting the part 2. So if you want everything that we have that's NCLEX related, make sure you get that, as well as the cardiac bundle. And then we will also be bringing back NCLEX Arcade. All right, so lucky 70 for 70% off. Tell your friends, tell your mama, don't tell your mama. Tell your lovers and friends that needs creative, especially the visual learners, creative nursing school notes, that Nurse Sam is having a 70% off sale, girl. Lucky 70. All right, Lucky 70. Use Lucky 70 at checkout, and this will last from today or this second all the way into the end of the day on Monday. So this is a weekend flash sale. Don't miss it. Do not miss it. Okay, so 70% off when you use code Lucky70. What's the name of the new kit? Which new kit? Because for T's, we updated with 2 new kits, biology and chemistry. For nursing school NCLEX, the newest kit that we made was the cardiac one. I forgot what it's called. It's gonna bother me. What is it called? Critical care. There we go. It's the critical care study kit. That one is not included. That was the newest NCLEX related or nursing school related study kit. So critical care study kit. And then, like I said, we'll be bringing back NCLEX Arcade this weekend as well. So that one, and that's not just the work, but that's the workbook and the 6 videos, which is 18 hours. It's 18 plus hours of video review. So if you like how NCLEX Jeopardy is, you will love NCLEX Arcade, because it's basically the same thing, just with a workbook as well. All right, so yay! I'm so happy for you guys. Does the ultimate nursing school bundle comes with everything except T's stuff and except the critical care study kit. All right, so the NCLEX study kit is included in the ultimate nursing school bundle. All right, NCLEX Arcade, though, that'll be something separate. That'll be up in like an hour. Okay? All right, guys, thank you so much for joining me. Do not forget to use code Lucky70 at checkout. I'll make my announcements and everything like that. But I just want to make sure y'all got it first, because y'all came to spend this Friday night with me. So I appreciate y'all so much. Thank you again for getting me to 70K. Like I said, I'll be making my posts, my thank yous, and sending my emails out. But I just wanted to give you guys first dibs and first access, because if you are coming to NCLEX Jeopardy, it means that you are actively preparing to take your NCLEX. And if you don't have any of my tools to help you, then this will be the perfect opportunity. All right, so thank y'all so much, and I will see y'all next time. Make sure y'all come back next Thursday, just regular timing, next Thursday at 7 p.m. for next week's NCLEX Jeopardy. And don't forget, I'm going to be uploading the rest of these questions to the app, the Nurse Sam app. It's free, so you can play the mobile version of NCLEX Jeopardy and the rest of this on your own time, at your own leisure, to get more questions. We only did about like 11 questions. It's 25. There's 25 questions. Okay, so I'm about to upload that into the app, and then that'll be it for me. All right, so if y'all have any questions, email me at support@thenursesam.com. Thank y'all so much. Do you recommend getting the updated nurse school if I purchase 2021 summer? If you purchase, the nursing school bundle since I think November 2020, I believe, it should be updated. You should have, it should have the 400-page updated one. Everyone that purchased it or won it was sent the update last year. It was updated last year. So if you purchased it last year, you should have the updated bundle somewhere in your email. If you don't, just email us at support@thenursesam, so we can look up your order, and we'll just send you the new link. Okay? All right. So thank y'all so much, and I will see y'all next Thursday. And if you're coming for your T's, I'll see y'all Tuesday. All right? Thank you.